my name is Ashley Van Zee, and today I'm going to be showing you guys some built-up handles for cards. So the client that I made this for is a 78-year-old male who had a stroke about 3 years ago. It was a left-sided stroke which affected his right dominant side. Since the stroke, he has recovered immensely. He's able to walk, talk. He can use both sides of his body fairly well, but he does have some fine motor coordination and dexterity issues with that right side. So his focus in therapy was regaining that coordination, grip strength, and grasp so that he is able to button buttons on his shirt when he gets dressed in the morning, feed himself with that right hand better, and also participate in activities with the activity center at the long-term care facility that he currently lives at. So the focus of the PICO was to use adaptive equipment to improve participation in ADLs and leisure activities. I chose to do this kit for this client in particular just to help him improve his participation and his satisfaction with that participation in his daily life. One of his favorite pastimes is playing cards. So not being able to grab the cards and play with other residents and members of his family was really devastating to him, and he described his fine motor coordination deficit as it feels like his hand isn't a part of the rest of his body. So you could just really tell that it was something that he wanted to improve. So I really think that this activity facilitated the use of best practice by using adaptive equipment to increase upper extremity and fine motor skills. I wasn't able to use this with the client, unfortunately, with everything that happened. However, I really do think that this would have worked great with him, and if not, I would have been able to adapt it using different sized foam pieces. So some of them were smaller, and then I also have thicker ones. So I think that he would have been able to use and adapt to the system very well.
Using this kit is fairly simple. It just involves velcroing the pieces of foam onto the back of the card, which also has a piece of velcro on it, so they do stick very easily and they come off very easily. The velcro that is on the card doesn't prevent you from being able to shuffle the cards, and it allows for patients with and without the fine motor deficits to play with this set of cards. There's also multiple sizes of the built-up handle, so that if the patient needs more or less of a built-up handle, you can easily switch to the handles that are more or less built up. The evidence behind this intervention was limited when looking at patients who had had a stroke and they were experiencing chronic deficits. However, there were multiple studies that found supporting adaptive equipment and compensatory strategies with clients participating in occupational therapy interventions. There was a study done on clients in the first year after stroke suggesting that receiving adaptive equipment really facilitates their independence earlier in the stroke recovery process. Another study also showed that clients with chronic stroke had a greater sense of satisfaction in their performance when they were given adaptive equipment, along with other compensatory strategies to increase their performance in ADLs. There was a case series that also looked at the chronic stroke population, finding that combining compensatory interventions such as using adaptive equipment like so with modified constraint-induced movement therapy actually showed a functional improvement in activities. There's also research that shows an increase in ADL performance with adaptive equipment in patients who have been diagnosed with these conditions, and other conditions such as osteoarthritis or rheumatoid arthritis. The adaptive equipment in these situations was able to help them to participate by decreasing the range of motion that was needed to complete the task, which is what these cards can do as well. The conclusion of this research really shows that using adaptive equipment can support the client as they gain independence in their daily activities.
Yeah.